Hi everybody, this is Mrs. Campagna, and I'm going to talk to you about test-taking strategies for NCLEX style questions. So the first thing that we have to think about with a question is, what is the question made up of? So each multiple choice question has four parts. We have a scenario, a STEM, a correct answer, and then we have three of those nasty distractors. So let's take a look at the scenario. So then the scenario is going to be the part of the question that kind of gives you what's going on. So what you need to make sure you pay attention to when you're looking at that scenario is things like setting. Where are you? Are you in the recovery room? Are you in a community health center? Are you in a doctor's office? Are you at the patient's home? So what kind of setting are you in? Time frame. Are you 2 hours post-op? Are you 3 days post-op? You have to see, because priorities change depending on, the time frame. How old is the patient? So considerations for older adults or children are going to be much different than considerations for a middle-aged or young adult. So please pay attention to that as well. Ethnicity. So certain ethnicities are at higher risk of certain diseases or conditions. So that may also play a role in the answer that you choose. Same thing goes for gender. Also, please make sure you pay attention to keywords like first, most, chronic, acute, early, late, things like that. Also, things like inappropriate or requires follow-up, or which one would you need to clarify, things like that, because those are going to also change how you're going to answer the question. So always pay very close attention to the words in the scenario and in the STEM, obviously. So speaking of STEM, what exactly is the STEM? The STEM is usually the last sentence of the question itself. And what it talks about is what it really wants to know that you know. So it's asking, this is where the question really lies. What the question wants to know that you know. So for example, let's look at a couple of these. So we have number one, the nurse has become aware of the following client situations. So then it would give you, each of your answer would be a different situation. So each answer would be a different situation. And it says the nurse should first assess the client who. So that keyword being first, it wants to know who's the first one you would assess. Another one would be number three. Let's look at that one. The nurse is caring for a client who had an appendectomy 4 hours ago. It would be necessary for the nurse to immediately notify the surgeon if the client ... Then you would have four answers of situations that the client has found himself in. Now that STEM means which of these situations is an emergency? Which one shows you that the patient is in serious trouble? Because it says immediately notify. Then we have another one, number four. So you have somebody who's getting furosemide because they have fluid overload. Prior to giving the medication, it would be most important for the nurse to assess. So this question wants to know, what do you assess before you give furosemide? And it says most important. So it'd be, what would your priority assessment be before you give furosemide? And then this last one, it says it would require follow-up by the nurse if the newly hired nurse is observed. That right there means which of the following answers shows you that the nurse is doing something wrong. Okay? That the newly hired nurse is doing something wrong. So these are all parts of the question, the scenario and the STEM. And notice we haven't even gotten to the answers yet. Now I notice with a lot of people, when they take and look at a question, they go right to the answers. They read the question once, go to the answers, and they never go back up to the question. That's a big mistake. You want to spend a little bit of time on the question, because the question is how you're going to figure out what to answer. So spend some time on that question. Figure out what it's asking you before you ever look at the answers. Okay, so now we can get to the answers. How do we answer these questions? Well, first and foremost, you got to know the content. I mean, you can't apply what you don't know. So you have to make sure you know that content. It's very important. You can't just study the night before, especially for like med-surg, fundamentals, things like that. You can't study the night before. You have got to study, a little bit every day. And that way, when you get to these tests, it's not just about content recall. These questions are going to have analysis and application in them as well. And if you are just doing things by memory, it's going to be very hard to apply things. You have to be able to know them and understand them. I often say that, and people have heard me say this several times, nursing school should be about 10% memorization and about 90% understanding. And that's very, very important concept because the puzzle analogy is a great way to visualize this. When you are memorizing things, especially in nursing school, it's like having a puzzle on a table with all the pieces there, but you still don't know what the picture is because it's not put together. If you understand what you're learning and you understand the rationale and the logic and the why behind things, then what happens is those puzzle pieces start to fit together and you actually get a big picture of what's going on. So please make sure that you are understanding the content, not just memorizing. So then when you get to these NCLEX style questions, the analysis and application part will be much easier for you. So one of the answer strategies is rewording the question to help it make better sense to you. This is always a good thing to do, especially if it is a longer type of question. Now, this isn't something I would recommend doing on the first exam, just, that's when you start it. No. You need to be doing this ahead of time on practice questions so that you are used to doing it and you can do it quickly, because we don't want to try to be rewording questions on the first exam when you're timed. Okay, so we want to do this when you are doing practice questions. Now, another thing is try looking at the STEM first to see what the question's truly asking. When you look at the STEM first, which is that last sentence of the question, it puts you in a mindset as to what that question's looking for. Like, for example, if it asks you which of the following would require follow-up, then you know that you're looking for something that's wrong. Then you would go up to the scenario and say, well, I'm looking for something that's wrong when someone's putting in a Foley catheter. Okay, then I know I'm looking for something wrong. So sometimes it's good to start with the STEM because it kind of gets your mind in the right place. And then you look at the scenario to see, okay, my mind's in the right place about this topic. Okay, the next thing, focus only on the information the question gives you. Don't read into the question. If the question doesn't tell you that something's happening in the scenario, it's not happening in the scenario. So you can't read into a question and assume. Don't put stuff there that's not there. If the question doesn't give it to you, don't assume that it's there. The same goes for the answers. If the answers don't tell you that it's there, then don't pick that answer because you're assuming that it's there. Okay, the next one is determine an answer in your head before looking at the possible answers. This is a very, very good thing to do because remember, we said that the anatomy of a question was the scenario and the STEM, but then we had one correct answer and 3 distractors, right? They're called distractors because they're meant to distract you away from the correct answer. If you already have an idea of what that answer should look like in your head before you ever look at the answers, you are less likely to get distracted by the distractors. If you have that answer in your head already of what it could possibly be, then the correct answer is more likely to pop out at you. Finally, pick the questions apart and analyze them, searching for keywords, cues for distractors, things like that. You want to look to make sure you have figured out this. And this last one is really good if you're struggling. If you're really struggling on trying to figure out what the answer is, really look at that question and say, did I miss anything in that scenario that would send me toward one answer? Like, does it say older adult in there? Does it say that I'm in a community health setting? What does it say? Is there anything in there that would tell me that, one of these answers should stand out above the others? So now let's look at some different styles of questions that you're probably going to come across. And guys, I want to make sure I emphasize the fact that you guys all have an NCLEX book, or you should be getting one, and it's the Saunders NCLEX book. NCLEX review books in general are usually very helpful for test-taking strategies. They're very helpful for, regular nursing school exam questions. They're also very good for NCLEX prep, obviously, and any other kind of standardized exam like ATI or HESI or anything like that. They're always good for that. Look at the test-taking strategies chapter of your NCLEX book and read through that. Very, very helpful information. Similar to this, but they may have other perspectives in there that I don't cover. So definitely take a look at that. And also, those books are great for practice questions. They are just an endless fountain of practice questions. And a lot of times when you register the NCLEX book online, you can get access to more questions. So definitely check into that. So one of the first types of questions that you'll see is the nursing process style question. So with the nursing process questions, most of the time it's going to ask you, what should the nurse do first? What should the nurse do next? Things like that. Nursing process style questions, you have to use chronological order and the nursing process. So if your STEM asks you, what should the nurse do first? Most of the time you are going to say, okay, chronologically, what's the first thing I would do? So chronologically, the first thing you would do when you walk into a patient's room is wash your hands or put on gloves. So you always look for answers like that, those simple answers, the ones that you would usually look over and go, nah, that's too easy. Those can sometimes be the right answer. Okay, the other thing is the nursing process, ADPI. Assess, diagnose, plan, intervene, and evaluate. We always assess before we intervene. So if you're given a scenario with a patient and it asks you what would you do first, you're not going to intervene on that patient until you've assessed what the problem is. So you always look at the answers and you say to yourself, especially if it's a nursing process question and it says, what should the nurse do first? You can look at each answer and you can say, is it an intervention or is it an assessment? Is each answer an intervention or an assessment? If it's an intervention answer, you have to say, do I have enough information to pick that answer? Okay, so if it says that, a patient is short of breath with a history of heart failure, do you have enough information to go ahead and give him furosemide? Or should you listen to his lung sounds first to see if he truly has crackles? Maybe his shortness of breath is from something else. We don't know because we haven't listened to his lung sounds yet. Okay, so we want to make sure that you have enough information in your answer, in your question before you pick an intervention answer on these types of questions. So I would say most of the time, if you get a what should the nurse do first, you are looking for an assessment, unless you have a full assessment in your question already. Okay, then you can go ahead and pick an intervention. But a lot of times you need to assess further. Now, if you have several assessment answers, prioritize. What's the most important assessment that you're going to do? So you're using your nursing process and you're assessing first, but what is the most important assessment of the answers that you're given that you would do? Okay, so here's an example. A nurse answers a call light on the post-op nursing unit. Client states there's a sudden gush of blood from the incision and the nurse sees a blood spot on the sheet. What action should the nurse take first? So should we assess the blood pressure, perform hand hygiene and apply gloves, reinforce the dressing with a clean one, or remove the dressing to assess the wound? So the first thing that you would do is you would wash your hands and put on gloves, right? Because that's chronological order. And the key in the question that tells you that that's what you should do is the fact that there's blood on the sheet. So that tells you that that would be the first thing that you would do is, you're going to wash your hands and put on gloves because there is blood present. Now the next one says, a nurse is assessing a client with hypokalemia and notes that the client's hand grip strength has diminished since the previous assessment 1 hour ago. What action should the nurse take first? Okay, so we're assessing someone with hypokalemia. We've tested the hand grip strength and we found that he's weaker than he was an hour ago. So what's the first thing I should do? So we have assessed the respiratory rate, rhythm, and depth, measure the client's pulse and blood pressure, document, or call the healthcare provider. So here we know we've got some assessment in our question, but let's look first at our intervention answers that we have here. Because remember, when we have a nursing process question, we look first at the intervention answers and say, do I have enough information to make that intervention? So the first intervention answer we have is to document, although that's not really an intervention, but we're going to put it in that category. So we're going to document. Document findings and monitor the client. When you pick document as an answer, you are saying that everything in that question is fine and there's nothing that you need to do about it. That's usually when you pick document. Now, D says call the healthcare provider. Picking call the healthcare provider means that you're saying that the scenario in that question is telling you that this is an emergency situation and that you need more help. The patient needs care beyond what you can give them. So anytime you give rapid response or calling the doctor as an answer, that is you saying that there is an emergency here and I need more help. Okay, so that's what it's saying. Do we have enough information to say that everything's fine with this patient or that there's an emergency going on here? No, we do not. So we need to assess further. So let's take a look at our assessment answers. We have assess the respiratory rate, rhythm, and depth, or measure the client's pulse and blood pressure. So we have 2 assessment answers. Remember when I said when we have more than one assessment answer, we need to prioritize. So which of these 2 would be a higher priority for a patient with hypokalemia? Well, if you're using the ABCs, it would be letter A, and that is the correct answer. We are going to assess the client's respiratory rate, rhythm, and depth as the first thing that we would do in this scenario. Okay, now when does the nursing process question become a prioritization question? Well, we talked about this a little bit before. If all of your answers are assessments, then you're going to prioritize, just like we did in that last one. Okay, prioritization questions. Now, these are notoriously ones that students struggle with. What is the most important thing? So the thing you have to remember about priority questions is priority means the most important thing you do for that patient. So we always say, if I can only do one of these things, meaning you've got 4 answers here and you have to pick the highest priority choice for you to make for that patient. If I can only choose one of these options and never see that patient again, so I have to pick one, leave the room, never see them again, what would I choose? Well, that kind of mentally forces you to pick an answer that's probably going to solve the patient's problem if you could, right? So you want to pick an answer that's going to solve the situation, because if you leave and you can never see them again, you want to solve the problem. So then I always say, once you pick your answer, stand at the doorway of that patient's room mentally, peek in and say, how is he now? How is he now that I chose that answer? So for example, you have a patient who suddenly developed new onset shortness of breath, right? Suddenly developed shortness of breath. And you have to figure out, what is your priority for this patient? Is it to call the doctor, or is it to listen to lung sounds? What's your priority? So I'm going to choose listen to lung sounds, because it's really important to listen to lung sounds so you know what's going on, right? That's my priority. So that's the one thing I can do for him, and then I have to leave the room and never see him again. So I listen to his lungs, and then I leave the room. How is my patient now? He is still short of breath. Did I solve the problem? No, I didn't. So what you need to do then is say, okay, wait. I didn't fix the problem. So let me look at something else. So my other option was call the doctor. Okay, so the patient's short of breath. I've called the doctor and reported that the patient's short of breath. Now I leave and the doctor comes to see the patient. The patient is okay because the doctor helped out. So some of you may be thinking to yourself, but wait, what did you tell the doctor? I mean, you didn't have any information to tell the doctor. You didn't have enough of an assessment to call the doctor and tell him. That's not the point of a priority question. The point of a priority question is to see that you know what is the most important thing that you can do to save your patient's life. That's what priority questions are. They're not about making sure you do everything in the right order. They're not about making sure you know what the first thing is you do. They're making sure that you know what's the most important thing that you do for that person, okay? So the reason that prioritization questions are often missed is because many times prioritization questions have 4 right answers. So all 4 answers, A through D, can be things that you would do for that patient. Yes, I would listen to his lungs. Yes, I would sit him up. Yes, I would, take his vital signs. But what is the most important thing I do? Right? So the most important thing you would do would be to get a hold of the doctor to get more help for this patient. So that's just an example. That's a rough example. But when you look at prioritization questions, if you see the word priority, most important, or essential, look for those types of scenarios, those types of answers, and see if you're right. Now, also when you're looking at priority, and you're looking at the answers and it says ABCs, you always say priority equals ABCs. And that is true to a point, but you also have to make sure that you remember relevance. So airway, breathing, circulation plus relevance. So you have to make sure that the answer you are choosing applies to the scenario that the question is talking about. So, for example, if you have a patient who just had knee replacement surgery, you go in and look at his dressing and it's oozing blood out the side. Okay, what's your priority? Is your priority to sit him up, or is your priority to put pressure on that wound, on that dressing to stop the bleeding? So your priority would be to put pressure on that wound to stop the bleeding. He's not having a breathing issue. So, putting him from semi-Fowlers to high Fowlers is probably not going to do anything to solve the bleeding in his leg. Okay? So it's things like that where you really have to make sure that even though you're picking ABC, you want to make sure that when you pick that answer, you have a strong rationale to back it up. Okay, so let's look at an example. So we have a client who's received IV anesthesia during an operation. What action by the post-anesthesia care unit nurse, or the PACU nurse, is the most important? So should we assist with administering muscle relaxants to the client, place the client on a cardiac monitor and pulse oximeter, prepare to administer IV antiemetics to the client, or prevent the client from experiencing post-op shivering? So you have to think of what's the most important thing that a nurse is going to do in the recovery room. The most important thing that a nurse is going to do in the recovery room is assess for post-op complications. So all of these other answers here, we have no information in our question to back up what what these answers are offering for us. There's nothing that say that they need muscle relaxants. There's nothing to say that they're vomiting or they need antiemetics, and there's nothing to tell us that they're shivering, okay? Or, that we would prevent it. The most important thing we have to think about is what are the post-op complications and how are we going to know about them? So we need to make sure we put them on a cardiac monitor and a pulse oximeter. That's the big priority for recovery room nurses, is monitoring for breathing problems, bleeding, and hypothermia problems. Those are the three biggies. Prioritization part 2. So, which patient should the nurse see first? So you ask yourself, which of these patients is the closest to death or injury if their needs are not addressed? Or which one will die or get hurt the quickest, right? So when you say you're giving 4 scenarios and it says, which patient should you go look at first? You have to say to yourself, which patients are the closest to death or injury if their needs are not addressed? So you want to pick your patient and then you want to examine the other 3 and you want to say, okay, how are they now? Are they still alive? Because I didn't pick them to go see them first. Did they make it? Are they okay? So you want to look at that. Okay, let's look at an example real quick of that one. The PACU charge nurse, sorry about that, notes vital signs on 4 post-op clients. Which client should the nurse assess first? So we are in the recovery room. Okay, that's always important to remember. Remember, that was part of the test-taking strategy, was looking at the scenario and saying, what's my setting? Where am I? And then mentally put yourself there. Okay, I am in the recovery room. The charge nurse notes that we have vital signs on 4 clients that are post-op. Who should the charge nurse go see first? Is somebody with a blood pressure of 100/50, a pulse of 118, a respiratory rate of 8, or a temperature of 96. So of those, we have 3, well, all 4 of them are pretty iffy, right? So we have 100/50. That's still okay. That's the low end, very low end of normal. It's questionable. That's a maybe, right? 118, that's a little fast, maybe. Respiratory rate of 8. That's serious, okay? He's 4 breaths below what the minimum per minute should be. And then a temp of 96. That could be concerning too, because 96.8 is usually about the coldest we want people to get. So, looking at this here, this would be, we would prioritize here, right? Airway, breathing, circulation. And I have rationale to back up that my respiratory rate of 8 is very serious because he's 4 breaths below what he should be. So I'm going to go ahead and pick that one. And that is correct. So respiratory rate of 8, airway, breathing, circulation. And we have the rationale to back that one up. Okay, so negative query questions. Need for follow-up, needs additional teaching, which one would require intervention, that type of thing. It's really good to treat these questions and answers like true and false. So you would put next to the needs additional teaching or needs for follow-up, you would put a false or an F next to that to remind you that you need to pick the answer that is false. And then you go down and you label each answer. That's a true statement, that's a false statement, that's a true statement. So you want to make sure you go through and find the false one. Your brain will automatically try to go for a right answer. It will try to go for an answer that's true. Writing the true and false down will help trick your brain into the right answer. Will help trick your brain into picking the answer that you need to pick, rather. Okay, here's an example of that one. After educating a caregiver of a home care client, a nurse assesses the caregiver's understanding. Which statement indicates that the caregiver needs additional education? So we can put this in our own words and we could say, so I am educating somebody who's caring for a patient at home. Which one of these statements would I not want to hear a caregiver say about home care? So I can help him shift his position every hour when he sits in the chair. That's good. If his tail, so I would say that one's true. If his tailbone's red and tender in the morning, I will massage it with baby oil. That's false. Applying lotion to his arms and legs every evening will decrease dryness. That's true. Drinking a nutritional supplement between meals will help maintain his weight. That's true. Okay, so now that we have our T's or F's next to each one, we can go back up to our question and go, okay, needs additional education. That's false. So then go down here and find the answer that matches, and you find the one that you labeled as false, and you pick that one. I always recommend once you've picked your answer, go back up and look at that question one more time and make sure that you didn't lose sight of what the question was asking when you were looking through all of the answers. It's always a good idea to do that. Therapeutic communication questions. Now these a lot of people struggle with, but there's a really, really simple formula to it. Now the keywords or the stems of these questions often are, how should the nurse respond? So you always want to look at the scenario and see what's going on in there. Usually the therapeutic communication questions have something to do with the patient being upset about something, right? The patient's upset or the family member's upset, something like that. So when that happens, we have to figure out how we communicate therapeutically. Validate and elaborate. So we validate their concerns. For example, you seem upset. And then we elaborate on their concern. We get them to elaborate on their concerns. We say, I see that you're upset. Tell me more about this. Tell me more about your concerns. But you have to get them to elaborate without asking why. We can't never say why. We can't say, why do you feel that way? But we can say, tell me more about how you feel. So you always want to validate and elaborate. You can either validate or elaborate, or you can do both. But you have to do at least one of those things as your answer when you're choosing, when you're faced with the therapeutic communication question. Here's an example of this one. A client on an inpatient psychiatric unit tells the nurse, I should have died because I'm totally worthless. Which should be the nurse's initial response? How would you feel if how would your family feel if you died? You feel worthless now, but that can change with time. You've been feeling sad and alone for some time now. It is great that you've come in for help. So the answer that most closely validates the patient's concern and trying to get them to elaborate is letter C. Then we have the risk factor questions. When you have risk factor questions, you have to ask yourself, who has the most and the strongest risk factor? So it's not just the most, it may be a stronger risk factor too. Not all risk factors are the same. So, like the slide says here, some conditions and situations put patients at greater risk for a complication than others do. So let's take a look at an example of that. So we have a nurse assessing clients on a med-surg unit. Which client is at greatest risk for pressure ulcer development? So here, because we're looking at greatest risk, if we have ages, we always got to take the ages into consideration. Now, it's not only the ages, we have to take other things in there too, but we're going to take the ages into consideration. So we have a 44-year-old, a 26-year-old, a 65-year-old, and a 78-year-old. Okay. So what I like to do is I like to go through each answer and I number the number of risk factors that they have. And then once you've got them numbered, you can also analyze the risk factors and make sure there's no risk factors in there that are stronger than another. But let's take a look. We have a 44-year-old on IV antibiotics for pneumonia. Does this put this patient at risk for pressure ulcer development? Not likely. Pressure ulcer development is all about immobility, moisture, poor nutrition, things like that. Let's look at the next one. 26 years old. No, that's not a risk factor, but he's bedridden with a fractured leg. Now, he's bedridden because he has a fractured leg, so he's probably still able to reposition himself if he gets uncomfortable. So he's a little bit at higher risk because he is bedridden, but he may still be able to reposition himself because he is 26 years old and just has a fractured leg. 65-year-olds. Now we're getting closer to the older adult risk factors. Hemiparalysis. That means he's paralyzed on one side of his body, and he's incontinent. So he's got 3. He's got 3 right there, right? So the first one had 0, the second one had 1, and the third one had 3. Let's look at this fourth one. 78-year-old, that's 1. Requires assistance to ambulate with a walker. So the patient still ambulates, but he just needs help. So I don't really say that that is much of a risk factor there. He only really has his age because he's still ambulatory. So I would say we would go with C on that one. How distractors are created. So now that we've kind of gone through some questions, gone through some answers, you've found out all about what the questions, how they're created and things like that. Let's look at how we figure out how to make the distractors. So we have look-alike, sound-alike meds and diseases. So for example, if you have a patient, and this is true for the second one too, symptoms, interventions, and complications of similar diseases. If you have a question about hypokalemia, there'll be distractors about hyperkalemia. If you have a question about asthma, there'll be distractors about COPD. If you have a question about hypothyroidism, there'll be answers about hyperthyroidism. So just always keep that in mind. So when you're studying for these questions, you want to make sure that you keep your content straight. I've told students several times that if you have similar diseases, one thing that would be good is to color code the diseases. Put hypokalemia in one color and hyperkalemia in another. Or if you don't want to use colors, you can use shapes. You know, put a rectangle around your hypokalemia symptoms and a circle around your hyperkalemia symptoms. And then that way, when you're looking at the test, if you see an answer, a question about hypokalemia, and you see an answer that's, you know, a symptom, you think about in your mind, be like, okay, that was in the circle, right? That was in the circle, so that was hyperkalemia, so that one's not right. So that's just one thing you can do. Just to, obviously, you still need to have the understanding behind things, but you can also have that as backup, so you have that picture in your mind as well. So make sure you have those diseases straight because they will put distractors in there for similar diseases. The entire answer is correct except for one word. This is another thing that's very, very common, commonly missed on the exams. So you may have a distractor that says, for example, if the question's asking you about post-op complication prevention, and it says, educate the patient on the use of incentive spirometry twice every shift. And you may just look at that answer and go, educate the patient on incentive spirometry. Yep, that's it. That's going to prevent a post-op complication. I'm going with that one. The patient, it's incentive spirometry 10 times every hour, not twice a shift. So that's why that one is incorrect. Then we also have intervention for ABCs, but they're not relevant to the disease. So I talked about that one already when I talked about the knee replacement. They may have answers in the as an option there that talk about airway, breathing, circulation, but they're not relevant to what the disease process is. So remember what I said about ABC answers. You have to make sure you have a rationale to back those up. Then we have the interventions appropriate, but not in the setting specified. So for example, you may be, the question may be talking about a home health nurse, but the intervention is something that's done in a hospital. Or it may be talking about, you know, something that you would do, up on the nursing unit, but not something that you would do in the recovery room. So you always have to make sure that the setting and the time frame, the answer that you choose, applies to the specified setting and time frame in the question. And then finally, we have symptoms and interventions that are appropriate for the disease when it occurs in a different age group. So, for example, young adult versus older adult, another one you have to be very careful about. So these are all things that test writers use to make distractors. And finally, we have, what do I do when I've narrowed it down to 2? So this is something that everybody struggles with. They always say, I got it down to 2 answers and I couldn't figure it out. What you have to do is you have to look at each answer. You have to say, does either one of those answers qualify for any of that distractor criteria? So any of those things, that the way the distractors were made in that previous slide, if either any of those answers have any of that in there, then you can throw one of them out, right? The next thing is plug each answer back into the question and see if there's a keyword in that question that makes one answer more correct over the other. Like maybe you have 2 symptoms of a disease, but one symptom is an early symptom and one is a late. Then you go up and you look at the question and you say, oh, it says what is a late sign? There you go. So always make sure that you look back up at the question to see if there's not a keyword in there somewhere that'll steer you in one direction. Another thing is to ask yourself, to answer the question, I am pulling information from, is it the book, is it the lecture from my instructor, or is it my personal experience? Personal experience, choosing answers because of what you've experienced, whether it be something that's happened to you, something that's happened to a family member, or something that you saw at work in healthcare, that could lead you to a wrong answer. The reason for that is the way we teach you in nursing school is the perfect way to do things, right? The ideal way. Also, the symptoms and treatments and things like that, what we teach you in school is what most people experience and what most physicians and healthcare providers use to treat. You may have an experience that's the exception to the rule. We teach the rule. So what happens is, if you try to use your personal experience to answer a question, it could steer you in the wrong direction because you're using, just a one-time experience. So just be very, very careful. If it is a personal experience, try to back it up with what you've learned in school from your book or from your instructor. Okay, so that concludes my my little video here on test taking strategies. Again, if you need any help, I'm always here. Please email me and let me know. Thank you.